Hello, everyone. Welcome to yet another episode of Digital Health News' flagship CIO podcast. Today, we have the pleasure of welcoming Mr. Arun Goyal, CIO at Sir Ganga Ram Hospital, on this podcast. A seasoned healthcare technology leader, Mr. Goyal has over 30 years of experience at the CXO level in both government as well as corporate sectors. He is known for designing innovative growth strategies as well as blending technology with people and processes. Mr. Goyal is currently driving digital transformation at Sir Ganga Ram Hospital. Let us talk to him and understand what are the digital transformation technologies at Sir Ganga Ram Hospital that he is implementing and some key takeaways from his journey. Thank you so much, sir. Thank you so much for joining us today.
Thank you, Aarti. Thank you so much.
So, my first question to you is the healthcare sector was once considered a laggard in the space of digitalization. But especially post COVID 19, it has undergone a major transformation, and there seems to be much more adaptation of the idea of digitalizing business processes and business operation within healthcare also. Give us a sort of bird eye view of digital transformation that is happening at Sir Gangaram Hospital and the digital technologies that you have implemented.
Yeah. So a little bit, I would correct the question that healthcare industry has not started post COVID only. The digitization was happening in the healthcare for quite some time.
Hmm.
Uh, I would say that the patient and the clinicians got more exposed during the COVID towards the digitization, but hospital operations were in the digitization journey for quite some time. If you see all the corporate hospitals, they have a good digitization in the healthcare arena, and everybody has been using a good hospital information system and laboratory information system. Had not these applications be there, in today's world, the healthcare operations would be very difficult to run on the manual
Hmm.
basis. I'll just give you the example to start with the laboratory information system, because you have too many instruments into the laboratory, and laboratories are based upon the automation on all the blood tests, etc. It will be very difficult to uh, process all the samples on manual basis and create the desired results and transmit it to the clinician and to the patients. So it's been long where healthcare industry has been using the technology for quite some time. But yes, I do agree that post COVID, the patient and the clinicians uh, came closer to the technology, I would say, because patient started using the telemedicine. Doctors started participating into the telemedicine and the virtual consultations. So that these were the two additions, I would say, post COVID, which
Hmm.
people from the outside see this as a thrust and adoption in the healthcare industry. So these are the two things which I say that got added post COVID. But yes, in some other hospitals where digitization were not there, so because of these adoption and attraction towards telemedicine and touchless invoices, pharmacy, e-commerce in the healthcare got accelerated post COVID. So
Absolutely.
yeah.
No, that's a wonderful overview that you gave. Hospital IT has always been there. Private hospitals were already focused on bringing digital technologies to their operations, but definitely COVID 19 gave a necessary push to the bringing it to the front row.
Yeah. So
So my next, yes,
if you see, I just wanted to add into that question. If you see the cyber knife or
yeah,
artificial intelligence into data analytics into genomics has been there for years there into the healthcare, because without digitization and without use of computers and technology, you'll not be able to analyze and create the data analytics of genomics based results as well.
hmm,
And not only that, we have implemented, I think, about 10 years back in the hospitals, robotic surgery. So all those things were there. It is not that post COVID all these things happened.
one of the critical aspects of digitalization is where and how to store the data. The strategies that you have to consider, whether you want on-prem data or whether you want data on cloud. What are some of the applications that you at Sir Gangaram Hospital run on cloud systems?
See, I'm of a different view on when we ask or we consider on the technology to keep the data on prem or on cloud, because this should be based upon the use cases and your need basis,
Hmm.
whether you want to keep the data on prem or on cloud. If opportunity given, I would prefer to keep the data on prem, because then you have a more secure environment. You will be able to control it, and it is under your eyes. You know what is happening to your data, how it is moving. And second is the latency thing. You have a better accessibility of the data. You need not to depend on the internet and the web to access the data. So there is no latency and you provide effective services. But if you have a multiple chain, multiple location environment where you need to have a centralized databases, centralized system, so there is no option but to have your data on the cloud. But in that also you need to take a decision. You have to take a very judicious technical decision whether you want to get into the public cloud or a private cloud. So that is
Hmm.
also your choice. Keeping into the consideration of the security and accessibility, you can keep the data on private cloud and make sure the security and accessibility of the data.
So my next question to you is regarding the human touch that is required in healthcare. We know that healthcare is one of the few professions today where human touch is very essential. But the process of getting to the consultation is many a times tedious for patients. However, there has been a steady growth of people seeking comfortable processes for consultations. On the other hand, the clinical staff also now wants to have a simpler process. How has online consultation and mobile app helped you manage patients as well as clinicians' expectations at Sir Ganga Ram Hospital?
So, yes, you rightly said that everybody, as a patient, wants a human touch and want to have a one-on-one consultation with the clinicians. So, people are not inclined towards the telemedicine and the virtual consultation with the clinician in case of any eventuality. But
Hmm.
yes, there is another aspect of it. If once you have a consultation and a doctor has seen you in person and consulted and tested everything, then the follow up, etc., and the post operations or post discharges or post main consultation, you can follow up with the virtual consultation. That's the main thing. Second, it depends upon the criticality of your disease. If the things are critical, then obviously you need to have a personal one-on-one consultation with the clinician. Or otherwise, if it is not a, it is the normal thing. If you have a simple fever and cold, etc., and if you are in need of consultation, you can have a virtual consultation with the clinician, and people are doing it. And that is, I would say that primary healthcare is catching up in the telemedicine.
Hmm.
So this
Absolutely.
is how. So this is how in the for the Gangaram also we are having the similar way. The follow-ups and the basic consultations, the patients are preferring and clinicians are also okay, and patients are adopting the telemedicine or teleconsultation in the need of follow-up and the primary consultation.
Let's move on to the next question. The convenience of digitalization also brings the responsibility of keeping the data safe. This year has seen increased attacks on healthcare organizations across the globe. We keep hearing about ransomware attacks and data leaks in healthcare companies and systems. What has been your strategy at Sir Gangaram Hospital to ensure that patient data remains in the safe hands?
Yeah. So as I told that most of the data is on prem. So we did have firewall updated firewall in place. Updated endpoints are in place. We have secured our DNS. We have secured our all the gateways and any access to the data. We have implemented authentication, multi authentication for the role based user access to the data. Furthermore, wherever there is a requirement of the public access of the data, we have
Hmm.
kept that data out of the environment, so that if something goes wrong, at least our main server and main data
Hmm.
remains untouched and our operation doesn't get impacted. So this is how in Gangaram we have addressed the current challenges.
All right. One of the key aspect of implementing digital technologies in the hospital is also taking care of the stakeholders, not only the management but also the clinical staff, the nurses, and other staff in the hospital. Change management is one of the most important aspect here. How do you manage with the people expectations of your clinicians, expectations of your management, and how do you balance the both?
Very good, very good. This is a very challenging question in every IT organization where you need to address the change management in an effective manner, where the technology get adopted flawlessly, and it becomes useful also from the user perspective. So my take there is I try to implement the technology where the user behavior gets impacted as minimum as possible.
Hmm.
So whatever users are doing in their day-to-day practice manually, the same thing happens with the technology. If technology is helping them expediting their routine behavior, then the adoption become easier. So my endeavor has always been to make sure that the behavioral changes in the user, be it the backend staff or the nursing staff or the clinician staff, doesn't get impacted. From that perspective, I'll just give you the one example which we did in the hospital when we were implementing the EMR solution. So in the EMR implementation, we tried every possible solution, wherein we started with the sound to text conversion, where doctor will speak and it will get converted into the prescription. It got failed because there were challenges into the sound to text technology, and you have to be trained yourself to make sure that whatever you are speaking in gets transmitted into the appropriate clinical translation. Same thing happened with the digital pen. Same thing happened with the digital optical papers. Everything got failed, and we tried doing it with the data entry, conventional data entry. In conventional data entry, either doctor would be doing. If doctor does, then the clinician to the patient eye to eye connect doesn't happen, because clinician is always engaged into entering the data into the screen. So that connect which patient see with the clinician is missing. So that technology also got failed. So with the failure of all these things, one fine day we came across one technology wherein a conventional way the doctor is talking to the patient and writing it on the pad as it is on the prescription, and giving it to submitting it to the patient. So we found one AI based technology wherein we are scanning the prescription, handwritten prescription, and converting it into the digitalization, and giving it a digitized prescription to the patient, and convert and keeping the digitized data into the our HIS. So this is how we were able to create a appropriate data, fruitful data, what medicines doctors are prescribing, what type of patients are coming, what disease they are carrying, and other rest of the symptoms. So this is how we didn't change the behavior of the patient, we didn't change the behavior of the clinician, but simultaneously we digitized the whole data in the EMR and proceeded further. So this is how we found successful implementation of the EMR into the hospital.
Sir, I think one point that gets highlighted from our conversation is how important it is of the trial and error functionality in this entire process. And that's why I think it is called digital transformation journey, because you go through technologies, you test technologies, you see what fits and what doesn't fit, and accordingly you take the next step. As a CIO, what do you think in your hospital at Sir Ganga Ram Hospital? What are the technologies that you see further being implemented? What are the technologies that are in pipeline?
So, Gangaram Hospital being a private hospital, but it has been old hospital, very old hospital. It has got a legacy problem in the operation as well.
Hmm.
So we need to change the behavior of the user as well while implementing the technology out there. Because in the technology, you have to change your behavior at times to make sure that effectively you are using the operations, and the patient or the customers are not getting impacted with that. So from that perspective, we started using digitized technology, wherein we now have 100% digitalization into the billing process, into the laboratory, into the radiology. We have a queue system out there which is based upon the billing. The moment patient gets billed on a particular service, be it the appointment with the clinician, be it from the laboratory perspective, they need to go and submit the sample, they or go into the X-rays or the MRI or CT. So based upon the billing, flash the on the respective screens, patient name and the queue number gets displayed so that patients are aware that what is my number and how much I need to wait. The moment they get the prescription gets digitized, and the same thing goes to the pharmacy. So if patient need to purchase the pharmacy, their packets are ready, they can make the payment, and they need to wait and stand into the long queues. So this is how we are implementing, and we are in the phase of implementation, so that we expedite the all processes and get the speedy care to the patient in efficient way, when users are not changing their behavior and adopting it, and patients are not uh, getting into the tedious processes of billing and the queue and the delivery of the sample or in the X-ray, etc. Similar way, the report,
Right.
etc., are available on a one ID which we allot to the patient. Just by giving that particular ID and some other component, they can receive the reports online. So this is how we are making sure that technology get implemented into the Ganga Ram Hospital.
Great to hear, sir. Let's move on to the next question, and I think this would be an interesting one. Artificial intelligence has dominated every conversation around healthcare technology in 2024. While there has been improved acceptance, how do you see the role of artificial intelligence maturing in the case of healthcare?
Yeah, so I would say that artificial intelligence word has been oversold. So
Hmm.
for artificial intelligence, if we simply see as we use into the EMR implementation, that's fine. That we have one handwritten transcription, and that is getting converted into the digitalized
Hmm.
format, and we are using that particular data for the further use of the respective information.
Hmm.
But if you are looking artificial intelligence based upon the data available, then the challenges are there, because you have to have a very hygiene data out there. You need to
Hmm.
make sure that data deduplication is to be happened before we implement some AI based upon the data. uh, if you want to create some clinical decision support system based upon the available data, you need to have a clean data to have a appropriate artificial intelligence implemented into the organization. Unfortunately, in the healthcare, as you mentioned in the earlier question, because the digitization didn't took place all across the board, so you don't have a complete data setting for the artificial intelligence and for the
Hmm.
purpose. If we have data that is not structured one, which can provide an input to the AI to provide the appropriate information. But as yes, as in when or as in wherever the clean data is available, artificial intelligence can be used effectively, and that's what we are doing.
So I asked you about the technology that dominated 2024. Now let me ask about 2025, since 2025 is just a month and a half away. What are your
Mhm.
IT priorities for the upcoming year, and if there are any specific technologies that you are keen on implementing at Sir Ganga Ram Hospital?
So we have been, as I told, that we are a very old hospital. We have been using many systems for the years. So now this year we initiated to refresh the technology, update the technology, or replace the technology. So we are in the
Hmm.
phase of those replacement and updation of the technology, and we would be keep continuing that in 2025. We have implemented the BI tool over and above the data which we have cleaned over the year, and now that is ready to roll out in 2025. So am very optimistic about the outcome of that particular implementation. Yes, the another thing is the EMR implementation, which is getting matured. I hope that by 2025 end, we would be 100% digitized hospital.
So, based on your digital transformation experience, what are the lessons or advices you would like to share with your fellow CIOs? Given the fact that, as you rightly said, some of the hospitals are just starting their digital transformation journey. So, what are your advice suggestions for fellow CIOs?
So I would say that any not only the hospitals, all the CIOs or all the technologists should adopt the technology not for the sake of the technology adoption. They should see the use of the technology and the user behavior. If user behavior doesn't change and efficiency gets improved, the adoption becomes faster and easier. As you mentioned, you were mentioning about the change management. So change manage, you need not to spend your more work into the change management and efforts to make sure that people do adapt and start using the technology. So make sure that all the technologies which is available in the market need not to be adopted. Only adopt the technology which are useful for you and fits into your environment.
Thank you so much, sir. Thank you so much for your time and this lovely conversation. I believe all the CIOs or digital health professionals watching this interview will have a great takeaway from this entire interview and this conversation. Thank you so much for your time.
Thank you, Arti. Thank you so much.